USDA now conducting studies on beef because of a bird flu outbreak. They do maintain, though, the supply is safe. The H5N1 virus has been found in at least 34 cattle herds across 9 states, and so far there have been no human cases.
News 8's Lisa Carberger is here with a Yale doctor with more information about this. Lisa.
Thanks, Darren and Ann. Joining me now is Yale medicine Dr. Albert Shaw, who specializes in infectious diseases. Doctor, welcome. You have been one of our COVID experts through the past few years. What are your thoughts on this bird flu? Are you watching this carefully?
Yeah, we're definitely watching it. I think the fact that relatively high percentage of these milk samples were positive suggests that the outbreak in dairy cattle is more extensive than we thought. So it's definitely a time for increased surveillance and trying to understand some pretty basic mechanisms about how transmission is really occurring in dairy cattle.
We've seen bird flu in 9 states, Ohio being the closest to us. The WHO and the CDC warn that the public risk is low, but should the public be watching this?
You know, I think it's important to realize that all the testing that's been done so far has not identified infectious virus in any milk sample. Now, obviously, we still have to build that out. But I would say that at the moment, all the information we have is that the milk supply is safe. Certainly would probably advise people to avoid unpasteurized milk or raw meat. But I think there are pretty good health reasons to avoid those in general. But I think pasteurization should probably inactivate the virus as far as we know.
Excellent advice. All right, let's take a look at what the USDA is doing now. We have some tips on the screen. They are sampling beef, also sampling muscles of sick cows and temperature experiments on cooked ground beef. Of course, the ground beef we've just heard about today. Having just come through COVID, the pandemic, people wonder about a bird flu vaccine. Where do we stand if someday we ever needed that?
Yeah, I think we're a long way from that, but you know, this is not a new virus like the COVID virus was, and so I think there are already vaccine candidates that the federal government has on hand. There are stockpiles of an antiviral medication, Tamiflu, to which the H5N1 virus appears to be susceptible. So I think we're in a little better spot than we were for COVID, but hopefully it's still early days and hopefully we won't need it.
All right, Dr. Albert Shaw, Yale Medicine Infectious Diseases Specialist. Thank you for your time and your insight on this.
Thanks again for having me.
All right, thank you.